Perfect. Thank you all for joining us today. My name is Trinity, and you are here with Bridging Voice. And I'm very excited for you to get to see this presentation. I think this really is one of those presentations that, as we like to call, is going to be very evergreen in that it will be around for a long time. This is important information for people within the ALS community looking to be getting a communication device in the future, as well as for speech pathologists also. It's just going to be a lovely presentation. And I'm very excited for you all because one of our newest members, Kat Cantor from Wisconsin, she's one of our newer speech pathologists. We luckily have a duo from Wisconsin, is going to be presenting to us today. This is her first time presenting, so lots of love towards Kat for our first or her first Bridging Voice presentation. So Kat, why don't you go ahead and share your screen? Perfect. Okay, lovely. So again, thank you for joining us here today. Kat, go back one, please. Perfect. Thank you for joining us, Preparing for Success, What to Expect in a Communication Evaluation for ALS Patients. And today is September 17th, 2024. So thank you very much for joining us. So let me start with a quick introduction. Again, we are Bridging Voice. We are a small but very mighty team. We have 6 speech pathologists, 1 occupational therapist, 2 amazing programmers, which is part of our secret sauce, and our amazing leader, Karina, who happens to be joining us today. We have, which this number is absolutely wild to think about, this tiny little team of which we've grown 1 to 2 people each year has assisted over 2,800 people and almost 2,900 people with ALS in 49 states and in 21 countries. And I actually think that number is probably a little bit higher for countries. All over the world, we have had the amazing opportunity to be able to impact the lives of people with ALS. It's been wonderful. Who are we in terms of our specialization? We specialize in customizations, innovations, mentorship to speech pathologists or other professionals in the ALS community, education, obviously, as you are joining us here today. And importantly, our services are always free. Super important for you to know. All right, next slide. So before I let Pat take over, I want to go over a couple of housekeeping things. I just want to remind you that if you are here to get some professional development hours, I need you to stay all the way to the very end, in which I will then be giving out the code or the link for the attestation of attendance, and you need to fill that out for me, please. You can also, as well, if you are unable to stay for the whole session or you need to go back and get some information, you are always welcome to join us on our YouTube channel, of which I'll be sharing those reference links a little bit later. You're always welcome to join us there, which all of the recordings are here. And then after the meeting, within a few days or so, I will also be sharing an email for you with all of the links and handouts that Kat will be going over today, as well as links to our YouTube channel, as well as our upcoming trainings as well. All right, with that in mind, I am going to hand it over to Kat.
So much, Trinity. Like Trinity said, I am Kat, and I am excited to be talking with you guys today about how to plan for success with a communication evaluation. And so to really go through all of those pieces, we have to think about a number of different aspects. First, understanding kind of what a communication evaluation is, what that'll look like, when you should have the evaluation, and then things that you can do before, during, and after the evaluation to really ensure that you're going to have the most communication success. And so, in order to understand the evaluation process, it's first important that we understand what we're talking about when we're thinking about communication. A lot of times people think of this as speech, talking face to face, but it's a lot more than that. Communication is really any way that we exchange information with someone else, um, and can include things like texting, emailing, talking on the phone, or even things when you're not doing it in person or in this real time, like social media. All of those are different ways that we communicate, and are really important when we start to have difficulties with those. And so, knowing what communication is, we now need to think about what augmentative and alternative communication is and why we're thinking about that when you're living with ALS. And so, augmentative and alternative communication, or AAC, are ways that you can either supplement or augment, or replace speech or using your hands to communicate. And so, it's a variety of different strategies and supports in order for us to do that. And so, now that we kind of understand that difference between maybe more typical communication and what we think of as AAC, it's important to understand what the difference is in those evaluations. A typical speech and communication evaluation is one where the evaluator, which is typically a speech therapist or speech language pathologist, is identifying gaps in your current communication and speech and suggesting maybe tools and strategies to continue to support you using those current communication methods. Um, it typically includes a short interview and then some formal evaluation of your speech, including looking at like the rate of your speech, how understandable you are to others, or your intelligibility. And then we'll include a brief discussion of tools or strategies that you can use to continue to use those communication methods. A speech and communication evaluation often happens in the context of an outpatient clinic, or sometimes if you attend an ALS multidisciplinary clinic. This is what your typical meeting with the speech language pathologist might look like, in addition to talking about some feeding and swallowing. An augmentative and alternative communication evaluation, or AAC evaluation, on the other hand, has a really specific goal of trying different technologies to try and identify the most appropriate AAC or communication device to support your communication. It's typically conducted in an outpatient setting, and is a longer appointment than maybe a typical speech and communication evaluation. Usually it's conducted by a speech language pathologist, but one who specializes in AAC. Not all speech pathologists have experience using AAC or evaluating people for AAC. So it's really helpful to make sure you're finding someone who has that expertise, and who has the expertise of working with people who are living with ALS. A lot of places that do the AAC evaluations also include other members of their team, like occupational therapists, assistive technology professionals, seating specialists, really anyone who can help support in finding that right communication system. One of the most common questions we get asked when we're thinking about this communication evaluation is, when should I have it? And you'll hear a lot of answers from different people. Mostly that'll involve things like insurance requirements or red tape. The reality is that you should have a communication AAC evaluation when your current communication strategies are no longer easy. And so if you find yourself thinking any of these things, like, I have to repeat myself, people are having trouble hearing me, I'm having trouble texting or emailing, my voice gets tired by the end of the day, all of these things are an indication that something's just not easy or not right anymore. And there are tools that are out there that can support you, and you could check them out. Now, of course, we do still have to think about some of those insurance requirements, but not necessarily to say that you shouldn't have the evaluation, just to make sure that you are armed with information about what kind of requirements there might be. Um, for a lot of people who are living with ALS, they have Medicare as an insurance. And an important piece is that you don't need a prior authorization in order to get an evaluation. And so if you're feeling like something isn't easy, it's definitely worth talking to a speech language pathologist and getting evaluated to see what tools might be appropriate. The other piece about Medicare, though, is that they will only purchase a device once every 5 years. And so it's important when you're looking at communication devices that you're thinking of one that won't work just now, but also in the future. And so if you're looking at a device and maybe you're able to touch the screen for a short amount of time to be able to select messages or type on an on-screen keyboard, we also need to think about the fact that there's likely going to be some motor changes and that you might not be able to use your hands. And so you should definitely be looking at devices that incorporate other ways to communicate, like using an eye tracker. Another piece that's important about Medicare is that it only covers 80% of the cost of a device. And so there is going to be a 20% copay. If you have supplemental insurance, sometimes they will cover that 20% copay. But if they don't, or if you don't have a supplemental insurance, there are grants that you can apply for through Team Gleason or through like state telecommunication equipment purchase programs that can help pay for that 20%. And that's something that your evaluator should know and be able to help with that funding process. If you have Medicaid for insurance, there are some variations in terms of how the plans might manage those dollars. So they often will require a prior authorization for the evaluation. So you should be aware that you might need to get that in place. And there might be differences in terms of what requirements they have in order to purchase a device. Sometimes they'll require a trial of a device before they'll purchase it for your permanent use. Those pieces are important to talk about with your Medicaid insurance provider and really think about before that evaluation. It's similar with private insurance in that it can be pretty variable. Many private insurances, unfortunately, don't cover purchase of speech generating devices, or they have specific plan exclusions. And so knowing that up front is important so that you can start thinking about other ways to get a device. For example, through a loan closet or another organization like Team Gleason or the ALS organizations like ALS United, ALS Association, or Compassionate Care ALS. The last thing I'll say about insurance, and then we can move on from the boring stuff, is that there are a couple of pieces that are important to know regardless of what insurance you have. There are restrictions on when a device can be purchased if you're residing in specific places. So if you're residing in a skilled nursing facility, or if you're currently inpatient at a hospital or planning an inpatient stay, it's important to know that they typically won't purchase a device during that time. Additionally, if you're enrolled in hospice, that's typically a time when a device can't be purchased through insurance either. So if you are enrolled in hospice or planning to enroll in hospice soon, that's something important to tell your evaluator as well. And so just some quick kind of takeaways from that overview of the evaluation is that when your communication starts to be challenging, when it's no longer easy, it's time for an evaluation. And you don't have to know all of the ins and outs of your insurance requirements, but just knowing that there are different restrictions is helpful. And making sure you're having that open discussion with your evaluator is going to be really important. And do the evaluation early. Having the evaluation kind of right before you need it can be tricky because there are some of those restrictions and it takes time to get the device in place. So make sure that you're thinking about it sooner rather than later. And so Once you have an evaluation scheduled, before you head in, you can think about kind of the three most important questions in order to make sure you're going to have a successful evaluation. What can I do? What current technology do I have? And what do I want to be able to do easier? What can I no longer do that's challenging? And all of those are going to be really important when you're talking with that speech pathologist to say, these are really my goals. We've created a handout that allows you to think through some of these pieces before your evaluation and really bring that in to prepare to speak with your speech language pathologist and advocate for yourself. One of the other important pieces of preparing for the evaluation is making sure you have the right things to bring with you. Um, Make sure that you bring anything that you typically wear throughout the day. So if that's glasses, contact lenses, hearing aids, all of those are going to be really important to have during the day of the evaluation because you're going to want to use the communication device at home when you're typically wearing these things. It also makes sure that the device is going to work even when you're wearing your glasses or not wearing them. That can be a really important piece. If you have dry eye or you use eye drops, it's also really helpful to bring those on the day of the evaluation because you are going to be using your eyes more, and there's more potential for your eyes to get a little dry. If you don't know the importance of eye health when we're thinking about AAC devices and eye trackers, make sure to check out our presentation that Trinity did in July on eye health to find out more information. Um, Lastly, we also want to make sure that you have supportive seating. So if you can, try to come to the evaluation in your power wheelchair. That will have kind of the most support and comfort for you, be able to have the most successful positioning throughout the evaluation. However, it's also not uncommon that people don't have your power wheelchair yet, or maybe you don't have the right band to be able to attend the appointment in it. And in that case, just make sure that you're bringing something to continue to support your neck and your head, like a neck collar or even a neck pillow can help to make sure you're comfortable throughout the evaluation and making sure that you're writing down or even better, taking pictures of the make and model of your wheelchair can be helpful because this is something that the speech pathologist will use to get you some accessories for the device mounting to keep it positioned appropriately for your use. The other thing that you can do before the evaluation to make sure that you're going to have the greatest success and kind of get the most bang for your buck during the day of the evaluation is to make a list of things that you want to be able to do on the device. So do you want to be able to type out simple messages and speak them to your caregiver? Do you want to be able to send emails to friends, or do you just want to be able to browse the web? All of those pieces are good things to know beforehand so that you can try them out on the different devices that you're looking to trial on the day. It's also important to see if you can try different eye trackers during the evaluation. Not all eye trackers are created the same, and each one is going to work a little bit differently with everybody's eyes. And so being able to try more than one will give you a sense of which one works best for you and how you're going to find that communication device that's the best fit. You can also request to try different communication software in a different way. The software is kind of how the device is going to be laid out. So, how are you going to find the keyboard, or how are the phrases listed out on the device for you to be able to select and speak? All of that is just going to be a little bit more or less intuitive for you based on your previous experience with technology and just kind of how your brain works. And so, trying out different software is going to help you find the best fit for you. And finally, because there are so many different pieces of the evaluation that you're thinking about, make sure you're keeping a list of pros and cons of the devices that you're trying, or enlist a caregiver, family member, friend to come with you and make sure they're taking those notes for you so that you can revisit them when you're thinking about which device you'd like to purchase. And so before the evaluation, the important things to really remember are to bring all the items that are going to be most important for your success on the day of the evaluation. Your glasses, your hearing aids, your eye drops, your seating. Know what your goals are with the device and ask to try out those kinds of functions. Make sure that you're trying more than one device if you can. Also know that if there aren't more options available or the options that you try just don't seem quite right, there are more options and there are other ways that you can try those, even if you can't try them in that one appointment. And we'll talk about that in a little bit. And so on the day of the evaluation, um, typically you'll start with an interview, goes over typical things like your medical history, if you have any other diagnoses besides ALS that may impact your use of a communication device. They'll also want to know about your eye health, um, anything like any history of eye surgeries like LASIK or cataract removal, any history of dry eye or any eye conditions like glaucoma, anything like that will be important for them to know as they're looking at different eye trackers and thinking about which one might be a good fit for you. You should also be prepared to share information about the medications that you're currently taking. The most important ones for the evaluators to know about are going to be medications for muscle spasms or cramps like baclofen, any saliva reducing medications, pain medications like opioids or morphine, or THC or marijuana, um, any over the counter medications like cough medicine or um, allergy medications. All of those can have an impact on how your eyes move or how the eye tracker is able to see your eyes. Um, for example, I once had a woman who I was evaluating for a communication device who didn't have any history of eye health issues, but every now and then we just kept losing her eyes on the eye tracker. We couldn't find them. And we found out that she was using a saliva reducing medication to help dry up some of her saliva, which was also drying her eyes. So, adding in some eye drops, we were able to find the eye tracker that was going to be the best fit for her. So, again, it just can help identify some of those issues that you might see. Um, you should also be prepared in the interview to give information about where you typically sit throughout the day. So, if you are sitting in bed in your power wheelchair, on a sofa, a recliner, inside, outside, all of those will be important for the evaluator to understand what kind of accessories or supportive mounts they can get to make sure you can use the device wherever you typically are. They'll also ask about the current technology that you have and what's difficult for you. So if there are specific um, situations that make communication more tricky, maybe talking on the phone when someone can't see you, or if you're reading emails or typing emails, that can be tricky. Knowing about your current technology can be really helpful too, because sometimes the devices interact with different platforms in different ways. So, for example, you might see that an iPhone can connect to a device in one way while an Android phone can't. And so it'll just be helpful for the evaluator to know so they can know what to show you as well. Oops, I'm sorry. The bulk of your evaluation is going to be trialing different devices. And best, again, to try out multiple if you can, particularly multiple eye trackers. The cameras are all designed a little bit differently to interact with people's eyes a little differently. Um, Unfortunately, A lot of the places that do AAC evaluations might not have multiple eye trackers, either just due to availability of equipment or just they have to bring in outside people to bring the eye trackers in. If that's the case and you try a device and it doesn't feel like a good fit, know that there are other eye trackers out there and you can request a trial directly from the company that makes the device to try them out as well. So just because you try one doesn't mean that it's not going to work. Know that there are other options. Um, One of the things too that can be really important is to ask about the level of support that a different eye tracker or communication device might require and what's provided. Some of the devices will provide technical support, in-person support from a local vendor, and some can have the option of having someone remote into your device. So they're able to see what's on your screen, make changes, all of those pieces. Unfortunately, right now, there are some devices where you can't do that just based on the operating system. So, for example, a lot of the iOS or Apple-based devices don't have that ability for you to remote in yet. And so it's just good for you to understand kind of what is going to be required and if there's going to be support available based on what skills and support you and
Smile.
your caregivers have.
Smile.
The other thing that you're going to want to do during the evaluation is try different activities. Um, and what I mean by this is really thinking about, again, those goals that you have. If you want to be able to type and say simple messages, you probably want to try out the keyboard. If you want to be able to read and respond to text from friends, then you're going to want to see what that looks like for the phone interface on the device. And maybe you want to try and browse the internet or use the computer part of the device. What will be important to do is to choose 2 to 3 activities that you want to be able to do and try them on all the devices that you're trialing. Then you'll really get a sense for which one feels more intuitive, which one is working better for you, and really get an idea of what's going to be the best fit. One of the things that's good to prepare for too is that it's going to be tiring. You're trying a number of different systems using something, your eyes, that you're not used to using in that way. And so knowing that it's okay to do device trials over multiple sessions, or really think about taking breaks to make sure that you're giving yourself that time to trial them out is going to be important. After you've tried devices, then it's going to be important to discuss what the next steps are and really make your plan. What type of device am I getting? When can I expect to get it? What are going to be your responsibilities? A lot of times there's paperwork that you need to sign. And sometimes that paperwork can be signed in person. Sometimes they want it signed electronically. Most times they won't even start submitting the paperwork to your insurance until you sign it. So making sure you understand what you need to be doing so that things aren't getting held up. And then understanding what it's going to look like when you get the device. How can I get it set up and what ongoing support am I going to have? On the day of the evaluation, it's important to really think about sharing the information that's going to be most important for your success. So what kind of things do they need to know about your eye health and about medications that you're taking? Make sure you try different devices. And if you don't find one that feels like a good fit, know that there are other ways that you can try those if needed. And finally, make sure that you're choosing 2 to 3 activities and try to do them on each device so that you're getting an idea of which one is the best fit for you after trying them on a couple of different ones. And so after the evaluation, you'll discuss how you're going to be getting the equipment. For most people, you'll be going through insurance to get the device purchased. And what that means is that the device would come directly to you and would be used for as long as you would need it. However, that process sometimes takes a little bit longer, anywhere from 1 to 3 months for the insurance company to review the documentation and approve the purchase of a device. Other times you might be getting a loan of the equipment. And typically you're getting a loan if you are maybe required to buy insurance before they'll purchase, or if there's some other reason why you wouldn't be able to go directly for purchase. And so some of the things you need to talk about with your evaluator are if you're going to be moving on to hospice or enrolling in hospice soon, if you are moving into a skilled nursing facility, that might impact the ability of it to come through insurance. All of those things are going to be important discussions for you to have with the speech pathologist. After the evaluation, the really important things that you need to guarantee are that you have a plan for the initial setup of the device, what your ongoing personal support is going to look like, any additional training sessions that you might need with the speech therapist, and how you're going to get help if you run into technical difficulties. Having an idea of these 4 pieces is really going to be your recipe for continued successful use of your communication device. And so the initial setup, after you've gone through all the process of getting a device through insurance, you've picked the right one, typically what happens is a vendor from the company that manufactures the communication device will come out and meet with you to set up that device. A lot of times they can come out to your home, but sometimes you might want to meet in clinic with the speech language pathologist to have support from both of them at the same time. It's important to make sure that you engage your caregivers in this meeting, making sure that they understand how to position the device, how to help make small adjustments are going to be really important because they're the ones who are going to help support you using that device day to day. Typically during this setup, the vendor will do pretty basic training, getting any mounts that support the device set up, attaching it to your wheelchair if that's how you're going to be using it, and making sure that some of that communication software and maybe some basic functions are set up on the device. Any more detailed questions are probably not going to happen during this initial setup, and we'll need some additional sessions with your SLP to make sure that you're finding the right. You also want to think about your personal support and how you can maximize their own strength to make sure that your communication is going to be supported. So again, engaging your caregivers early is going to be really important. Make sure that they are part of that first setup and part of any additional sessions that you're planning to do. Make sure you are thinking about what the different people's strengths are. So if you have someone who's really tech savvy, maybe they are the ones who are going to be helping to contact tech support or making sure that the device stays updated. All of those pieces can be a really good fit for that person. Whereas maybe somebody who's less tech savvy, but is really there to have deep conversations can be helpful in identifying what you can do to have more conversations, to have phrases programmed into your device to make it sound more natural. Really leveraging each person's strengths will help make sure that everybody feels like they're a part of that team and making sure that the communication device is successful. And if you're missing some of those pieces, make sure you're knowing where to find additional support. Ask your speech pathologist, ask other friends if they have a kid or a grandkid who's really good with technology. They can always be a great support. I'm sorry. Also, make sure you understand the plan for additional training sessions with your speech therapist and understand what those goals might be. You might want to make sure that you can always type out simple messages that you want to be able to on a keyboard. So you want to make sure that the speech therapist knows how to help you make changes to a keyboard if needed. Make sure that they can help add in phrases to make communication faster. Um, or if you've done any voice preservation, make sure they can help add in those voices or messages. And then setting up any of those additional goals that you had. Can they help make sure that you can get to your email, your phone? All of those are going to be really important pieces. It's also good to understand what the ongoing support from your speech pathologist can look like. Um, if are they able to come to your home? Can they help support you via telehealth? Do you always have to come in clinic? If you do enroll in hospice or you go to a skilled nursing facility, how does that support change and where can you find additional support if this speech therapist is not going to be able to provide continued support? Can you find support from the device vendor, from another organization like Bridging Voice or the ALS Association? What are your options and how can you make sure you're going to be getting continued training and support you need? And finally, make sure you understand how to get technical difficulty support. Technology can and will break. The device will freeze. Something will break off of the back of the device. Something will happen where the Wi-Fi won't connect anymore. All of a sudden, your eyes aren't working. Know the number for tech support and write it down on a post-it note, put it on your fridge, put it on the back of the device. Just put it somewhere where you know that you can access it to make sure that you have that number quickly if you need it. And so after the evaluation, the important things to really make sure that you're having that success are to make sure that your caregivers are engaged in training. Make sure you're using their strengths and really helping them to feel empowered to support your communication device as well. Know where to get more help. Know if you can contact the vendor if you have questions, where your speech pathologist falls into that support as well. Those will all be really important pieces to know as you're thinking about your continued success and changes with your communication. And finally, write down tech support's number. It's something that we call every week. And so it's important to know where that is and how to get in contact with someone if you're experiencing changes. And so overall, there are a lot of different pieces to a successful evaluation. And I know that we went through a ton today. The big things to know in order to have a successful evaluation is that do it the earlier the better. So when your communication is no longer easy, when your strategies aren't working anymore, that's when it's time for that evaluation. Even if you can still speak, you're noticing there are certain times of the day where it's harder. That will be a really important time to be able to participate in that evaluation and make sure that you're getting that right. Know what your goals are for the technology. Know that it doesn't just have to be for you to type messages and say them. You can use it for texting, for browsing the internet, for sending emails, for writing a book if you want to, and know how to ask for those things when you are trying different communication devices. And finally, make your plan for success after the evaluation. Engage your caregivers, make sure you understand how you can get support from your speech pathologist or from other organizations if needed, and make sure to adapt that plan as needed to continue your success. And so that's all for my training today, but make sure you join us next month in November for a fabulous presentation on dates with voice preservation strategies and their use within communication apps. And then Trinity, I'm going to hand it back over to you here, I think.
It's helpful if I unmute myself when having a conversation. So, I want to just share a little bit of information with you guys. So if you have any questions about bridging voice, if you would like to sign up for future trainings, or if you would like to join us on YouTube, um, Kat was wonderful and shared so many of our past information. And I want to share that with you here. So it is dropped into the chat. I also want to acknowledge that some people are having a hard time getting the information out of the chat from the link. But very importantly, you need to know that all of the links that we're sharing today are going to be shared with you in an email that will be sent directly to you, which is one of the reasons why I really encourage you to sign up for our trainings. Because even if you can't join us, you still get the benefit of getting all of the information. A link to the YouTube recording, links to all of our resources that we're providing you. And we do keep those up to date. So as things change, I go in and change that information to make sure that that stays up to date and accurate for you. And now I'm going to drop our attendance link as well. If you would like to get a professional development certificate, please join us and fill out the attendance attestation. That's there. Wonderful. Okay, now I am going to go ahead and stop your screen share, Kat, and I'm going to open it up to any questions or comments that people have. There have been a couple already dropped into the chat, so I'll start with those. And then otherwise, please feel free to turn on your microphones, turn on your videos, participate in whatever way that you feel comfortable with. A lot of our Bridging Voice team is here. We are here to answer specific questions that you have or talk through some things. So I am going to start with Tom's. Tom, you said that you would like to purchase a good quality and sturdy wheelchair mount. Any recommendations? So I know that you're going to be meeting with Deborah, so I'll let Deborah take that one for you.
Hi, Tom. I can't recall. I'm gonna have to look up. I think what mounts you received with your pilot that you received. But we can either reapply to insurance to get a mount. If you didn't receive any mounts, we can apply for a wheelchair mount along with a floor mount. Otherwise, we would go to a local to a loan closet like the Team Gleason Foundation or potentially your ALS association. We'd have to find out the information on your wheelchair and be specific about the device you have, and we can design one that can fit your wheelchair.
Okay.
Okay.
Yeah,
So we'll talk
I
about it more
have
tomorrow.
I have a floor mount only.
Okay, so
But,
if that's
yeah,
the case, then we probably can't go back to insurance for another mount, but we'll get one from a loan closet for you.
yeah, I'm gonna use my Dolby to watch football as well.
As you
I
should,
have
as you
it
should.
Cannot
in,
we cannot let you
in
miss a game.
my big screen TV.
Perfect.
I am going to make sure that you can watch football on that Toby. Absolutely.
Not the Giants.
I can't. We have these folks are all over the country, but we all know that the Jets are the best team. Yes.
I might
Wow.
become a Jet fan.
All right.
Yeah.
I'm going to move on after that. Those some strong words that are now emboldened in YouTube forever. Becca had a question. What do you, Bridging Voice, do for someone who is interested in getting a funded speech communication or speech generating device, but does not have an SLP? Huh?
Yeah, so if you're not currently working with an SLP, we might try and find one locally. Otherwise, if we are licensed in your state, we might help support an evaluation by having the device vendors come out to your house with the devices, and then we can kind of help evaluate virtually. Or we will try and find one through a loan closet. We are not licensed in your state. That's something that we will do as well. But I'll let Deborah add on if I missed anything.
If you do have a home health care speech pathologist or another speech pathologist that can get to your home, we can help that speech pathologist do the evaluation for you as well. Yeah.
We provide a lot of mentorship to speech pathologists that are interested, but maybe just don't have the training.
Absolutely.
We're happy to help as well. So another comment was, I heard that there are grants available to cover the copay for a speech generating device, which is often about 20%. Is that true?
That is true. And one of the grants that we often people apply for is the Team Gleason grant. They will help to cover that 20%. But there are also state programs, the telecommunication equipment purchase programs. They're labeled a little bit differently in every state. Those also can typically be used towards that 20% copay.
Does anybody else have any other questions? Mara, go ahead.
Thank you. So I am new to this. I have only been to my local ALS clinic one time. I think that I am probably going to need some sort of a device soon because my hands are almost gone. Do I work with an SLP in my ALS clinic? Is that how I get an appointment set up?
That's a great question, and it definitely varies by clinic. But you can talk to your clinic team and say, I'm interested in the evaluation. Some of the ALS clinics, the speech therapists will be the ones who will do an AAC evaluation, and sometimes they'll refer to someone who's either more local to you or more specialized in that AAC field.
Okay, thank you.
So Mara, one thing I am going to add for you because you're telling me that your hands are having a hard time, but your speech still sounds fabulous.
Thank you.
So a lot of what we are talking about today too is, a speech generating device, which is what insurance wants to pay for. Which then that means, but your speech sounds fabulous. So it sounds to me more like you are in need of some access assistance, your ability to access technology.
Okay.
And so in that regard, then, having an access evaluation, and Eddie, who I absolutely adore and look up to when it comes to access, he's my favorite. I'm not just saying that because you're here, but he really is. So even, for example, having an access evaluation, which is oftentimes an occupational therapist versus the speech pathologist side
Got
of
it.
things,
Okay.
would be a great way for you to have a conversation. Now, that being said, um, again, you can get support with getting that equipment for being able to access technology through different grants, either the ALS Association, a United chapter, or even Team Gleason as well. You are also welcome if you do not have somebody that is available to give you that access evaluation, please come see Eddie. Well,
Okay.
virtually. Eddie can go to Cabo to see you. I'm sure he will not be angry about that at all, Mara. Not at all. And I think he might need some backup. So we have one, two, oh, great. We have 5 speech pathologists. We could all
Great.
come.
It'll be the most thorough
Oh, Tom
access
wants to come
evaluation
too.
on
Tom
this
wants to come
planet.
too.
Yes. We'll make it a group event. No.
It will be.
I mean, you can use, real quick, you can use your strong voice to access all your technology as well. Yeah.
Okay, great. Thank you for clarifying the differences between those. I appreciate it. That was helpful.
Yeah, so that's kind of why it's like an SGD, speech generating device. And sometimes some people will find that they kind of get hung up. Kat was talking about when things get difficult. And in some clinics, sometimes that gets a little dicey when it comes to how bad is your speech.
Mm-hmm. Interesting. Okay, thank you.
Anybody else have some great questions? Mara, that was We could not have planted that question any better. So thank you for that. Thank you for that. All right. So I think if no one else has any more questions about this, I am going to go ahead and we're going to say goodbye to our YouTube channel and subscribers. So thank you for joining us today. If you liked our video, please subscribe and join us again. I am going to stop our recording now.